My name is Dr. Mitzi Joy Williams. I'm a board-certified neurologist and multiple sclerosis specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. I also foster collaborations between patients, advocacy groups, and other organizations to increase diversity in clinical research. I'd like to discuss 3 secrets to fighting MS relapse. Over the past 10 years, I've had hundreds of people come into my office, and whether they've had MS for 5 months or for 15 years, they ask me the same question. Dr. Williams, how do I even know if I'm having a relapse? The first secret to fighting MS relapse is to know when you're having one. So how do you know that you're having a relapse? A relapse is defined as a new or significant worsening of neurological symptoms that lasts at least 24 hours and is not accompanied by fever, infection, or extreme stress. Why is this important? This is important because sometimes MS symptoms can temporarily get worse. For instance, if you had a long, exhausting day, or if you've come off of a long trip, sometimes people will say, Dr. Williams, I was really fatigued and it lasted for a couple of days and then it got better. So those are normal fluctuations. And sometimes you'll even just have a bad day. You might wake up, your balance is off for that day, you go to bed and you get back up the next day and it's back to normal. That would not qualify as an MS relapse. An example of a relapse would be if you say you've had numbness on one side of your body. That gets significantly worse and it lasts for several days, and typically relapses even last for several weeks. So several days to several weeks of worsening of symptoms is a usual definition of an MS relapse. So it's important to know and listen to your body because everybody with MS is different. So you know what your normal and your baseline is, and if you feel like things are significantly worse, then that's a good reason to start thinking about contacting your healthcare provider for medical attention. So number 1 is knowing when you're having a relapse. Number 2 is knowing when to call your physician or your healthcare provider to seek medical attention. Why is it important to seek attention for relapses? Number 1, because there are treatments available, and so we can't help you and we can't treat you if we don't know that something is going on. It is not uncommon for someone to come and see me for a 6-month visit and they say, Dr. Williams, by the way, my leg was dragging for 2 or 3 weeks and it went away, so I didn't call. And even though in that case it did get significantly better, sometimes relapses can put you at risk for more significant disability. So we like to try to identify those and treat them, and also it gives us information about your therapy for MS. So if your disease modifying therapy is working properly, then hopefully you won't be having relapses. But if you are having them, then it may be an indication that your treatment is not working optimally, or that might not be the best treatment for you. So it's important to know when to call your doctor and when to seek medical attention so that we can discuss treatment options. So knowing when to call your doctor is, again, when you're having those symptoms that are significantly worse and you haven't been sick and you haven't had an extreme time of stress or an extreme time of fatigue, then you would contact your doctor to seek an evaluation, and then they would decide what to do from there. So number 1, knowing when you're having a relapse. Number 2, knowing when to contact your medical provider. And then finally, number 3, understanding your treatment options. Now, all MS relapses are not necessarily treated with medications. Depending on when you get in to see your physician, the symptoms may be very mild and you all may make a mutual decision not to do treatment. But there are treatment options that help speed up your body's recovery. The most common option is corticosteroids or steroids, which many of my patients have had at multiple points during the course of their disease or during the course of them living with MS. Steroids are basically medicines that are given in IV, so it's given intravenously or it's given by mouth. And what they do is they basically decrease the inflammation in the body to try to help your body heal and improve from an MS relapse. Now, you're going to get from point A to point B whether or not you get steroids, okay, they do not make you overshoot or improve past point B. But what they do is help you get there faster. So if we can have you feeling better and back to your regular activities in several days versus several weeks, or several weeks versus several months, then we want to get you better as quickly as possible so you can get back into your normal everyday life. And again, one of the ways that we treat relapses is by adjusting your disease modifying therapy. So we give medication to try to speed up your body's ability to recover, but we're also keeping in mind that if you're having relapses, that your medication may not be working like it's supposed to. So those are 3 secrets to fighting MS relapse. It's important to know and recognize when you're having a relapse, know when to contact your healthcare provider for help, and also know your treatment options. And so that way you can be an active part of your healthcare team and work with your doctors to live your best life with MS.